Welcome, my name is David Owens, and I will be discussing the comparison of recruitment in forearm muscles between eccentric, isometric, and concentric contractions. Nakazawa et al. Examined the elbow flexors and found a significantly higher EMG activity during concentric contractions versus eccentrics given a constant weight. Similarly, Westing, Cresswell, and Thorstensen investigated the quadriceps and appeared to have a similar outcome when comparing maximum loads, and found that velocity-matched concentric loads were showing significantly larger EMG readings when compared to eccentric loads. Another consideration must be attributed to how the data is acquired. Specifically, Soderberg recommended to utilize a normalized set of EMG readings, such as the percent of maximum voluntary contraction, or percent MVC, when measuring between subjects or between muscle groups. This study aims to confirm these findings with the forearm musculature. It is hypothesized that the muscle recruitment using percent MVC will be greatest during the concentric motion, followed by isometric, and lastly, eccentric loading will have the least amount of muscle activation. A total of 8 subjects were recruited from the class of 2020 at Regis University's DPT program. These subjects had surface EMG electrodes placed on their flexors and extensors and were in a standardized seat position for performing the wrist extension and flexion movements. First, subjects performed maximum voluntary contractions so that the percentages of muscle contraction could be calculated. Then subjects performed eccentric, isometric, and concentric movements with the wrist flexion and extension motion. The results showed that the highest percent MVC was attributed to the concentric muscle actions of both wrist flexion and extension. However, for wrist flexion, isometric percent MVC was less than the eccentric motion, and for wrist extension it was vice versa. These results predominantly supported the background research, as the order of muscle recruitment from greatest to least was concentric, isometric, and eccentric for wrist extensors. The only odd part of the data was related to wrist flexion, where the eccentric motion elicited greater muscle recruitment than the isometric motion, which is especially odd when you consider that the internal moment had to be greater during the isometric hold compared to the eccentric movement. Further studies should be conducted to discover if this was due to error. The clinical relevance largely will impact therapists who wish to treat patients with low muscle activation. According to these results, it appears to be important to include an exercise regimen that features concentric contractions to maximize muscle recruitment in the targeted muscle. Thank you for listening.